Hi, I'm Dr. Vivek Belathur. I'm consultant medical oncologist at Precision Oncology Clinic and at Fortis Hospital, Banegada Road. We are here to discuss about one important topic, esophageal cancer, also known as food pipe cancer.
Hi, I'm Dr. Shyamsundar, consultant radiation oncologist at Precision Oncology Clinic. So today we will be talking exclusively on cervical esophagus. So before going into cervical esophagus cancer, let us know what actually cervical esophagus means. Esophagus is food pipe. It is a pipe or a conduct which connects the mouth, that is the lower part of the uh, throat, to the stomach. So the food pipe extends from the cricoid to the stomach. So this food pipe is usually divided into three parts. The upper one third is called as the cervical esophagus. The second and third part are thoracic esophagus and lower thoracic esophagus. So today we will be exclusively talking about cervical esophagus. That is because the treatment of cervical esophagus is significantly different from the treatment of the other parts of esophagus. That is the middle two third and the lower one third of the esophagus. So today we will be concentrating only on cervical esophageal cancer. Uh, Esophageal cancer per se uh, has been increasing of late, especially in India. As per the latest statistics, also, esophageal cancer has been one of the fastest rising cancers in our country. The signs, symptoms, and the risk factors of cervical esophagus cancer will be discussed by Dr. Vivek.
For esophageal cancer, there are certain risk factors or what we call causes. So, the most important ones are smoking and alcohol consumption. So apart from this, in India, people have the habit of chewing areca nut and also uh, betel nut. So these are the other important causes, and other causes like zinc deficiency, folic acid deficiency, selenium deficiency are also attributed as risk factors. And some of the infections like human papilloma virus is also considered a risk factor for this esophageal cancer. In addition to that, excessive red meat consumption is also considered a risk factor. So, coming to the symptoms of esophageal cancer, so one of the most important symptom is difficulty in swallowing. So, patient may have difficulty in swallowing either solid food or subsequently even liquids, and they can also have pain while swallowing these food, either solid or liquids. And apart from that, they may have pain in the chest, which is also considered as an important symptom, and they may have reflux symptoms, gastritis symptoms, and rarely they may have weight loss because of the decreased food intake, and they may have severe fatigue or tiredness. So these are some of the important symptoms of esophageal cancer.
So once the patient is symptomatic, he comes to the clinician. So the first what the clinician will do is something called a clinical examination, wherein he'll usually check the neck for any swellings. Sometimes cervical esophageal cancer presents with lymph node enlargement. So lymph node enlargement is usually seen in the supraclavicular fossa or in the lower neck. Okay, lower neck in the sense lower portion of your neck. So if any lymph nodes are there, then the clinician may order for an FNAC from here. However, in most cases, lymph nodes may not be palpable or may not be clinically significant. In these cases, the clinician will usually order a endoscopy. So when an endoscopy is done, the esophagus will be visualized from inside, and usually the esophageal cancer is seen as an unhealthy, bleeding, or an ulceroproliferative growth. So from here, a biopsy will be taken, and also the extent of this lesion or the cancer will be noted. From what position is it starting and up to what length it is going, and what is the area that it is covering. So this clinical information will be very relevant when we plan for the treatment. So once the endoscopy is done and the biopsy is taken, this biopsy is done for histopathological investigations. And once we have a confirmation that it is a malignancy, that is a cancer, next we will subject the patient to other investigations, imaging investigations, also called as staging investigations.
So, staging of cervical cancer is very important to determine the treatment or to plan the treatment. So, staging is done by three imaging modalities. One is endoscopic ultrasound, and the second one is CT scan, and the third one is PET CT scan. With the combination of these investigations, or sometimes one of these investigations, we will know the exact stage of the disease. So, staging is important because the treatment differs with each stage. So, for stage 1 to 3, we call it as non-metastatic disease, and for stage 4, we call it as metastatic disease, or the disease which has spread outside the food pipe. So, the treatment differs from for these treatments. So, when we discuss about treatment of cervical esophageal cancer, uh, surgery is not a good option. So, generally, we do not do surgery for cervical esophageal cancers because it is an extensive surgery and it involves the removal of the larynx, that is voice box, and it may not be a good idea to do such big surgeries for this particular condition, and hence radiation along with chemotherapy, that is concurrent chemoradiation, is the best treatment choice for this condition.
So when surgery is not possible, the next treatment of choice will be radiation along with concurrent chemotherapy. So in cervical esophageal cancer, we do external beam radiation. That is, we will give radiation from the outside, also called as teleradiation. So the patient will undergo radiation for about 30 to 33 days. From Monday to Friday, that is weekly 5 days. Saturday, Sunday usually will be the rest days. So the patient will require treatment for about 6 weeks. The actual duration of treatment will be 10 to 15 minutes. And usually the patients or the patient attenders, they want to know uh, what are the side effects because of radiation. When we do radiation, in the process of doing radiation, the patient will have no side effect. That is, they will not have any pain during radiation, they will not have any discomfort, or their symptom levels also will not increase during radiation. However, as we do radiations from week 1 to week 2 to week 3, what will happen? Gradually, the size of the lesion will come down. Along with that, the esophagus, that is the food pipe, mucus also will develop some reactions. This is what we call as mucositis. That is, there will be small wounds on the esophagus because of the radiation. This can sometimes cause difficulty in swallowing food, especially spicy food, coarse or hard food. So usually patients on radiation, we usually advise them to take soft, bland, protein-rich food. So most often these patients will be on semi-solid or soft foods. However, sometimes the patients will have severe symptoms and they will not be able to take any food at all. So in these patients, we will have to ask the patient to undergo feeding procedures. That is either PEG or feeding jejunostomy. That is, we put a pipe directly into the stomach. Or in third is rise tube, which you would have seen very commonly, that we put a tube through the nose into the stomach for feeding purposes. But doing this feeding procedure after starting the treatment will be very difficult. So usually, what we advise patients is when they come to us in the preliminary workup of the patient itself, we will see what is the swallowing capacity of the patient. If the patient is already having dysphagia, that is difficulty in swallowing, we usually advise them to undergo this feeding procedure before the treatment. Some patients who are intake is quite good, they're able to tolerate solid food and all, we can take a chance and go for radiation. However, it is always preferable, especially in the cervical esophagus cancer treatment, to always undergo a feeding procedure so that we can maintain the nutrition of the patient during the treatment. So once the nutrition part is taken care, then the treatment will happen smoothly. When the nutrition is compromised for these patients, then they will be subject to extreme weight losses, and they will not be able to sustain the treatment. So once we have taken care of their feeding problem, we will proceed with radiation. Like I have already told, they will require 6 weeks of radiation, 5 days a week. The radiation time will be 10 to 15 minutes every day. The side effects are, like I told you, immediately there will not be any side effect. Week 2, week 3, patient will be fine. Usually they will develop mucositis and edema from week 4 and week 5. And these toxicity or side effects that we see are not long lasting. Once the radiation is over, things will start reverting back and will be come back to normal in about 3 to 4 weeks. So, along with radiation, the patient will also require chemotherapy called concurrent chemotherapy.
So concurrent chemotherapy is also important part of this treatment of cervical esophageal cancers. So it is given in two ways. One is weekly chemotherapies, wherein patient receives this chemotherapy once a week, as long as the radiation lasts, maybe 5 to 6 times. Or we can also give this in 3 weekly forms. That is, once in 3 weeks, we admit the patient for 4 days and then give this treatment. So generally, chemotherapy also doesn't come with a lot of side effects. However, they can have some side effects like nausea, vomiting, sometimes loss of appetite, rarely low blood counts, infections, etc. But mostly they are manageable. So concurrent chemotherapy is very important because this treatment helps radiation work better. So once the concurrent chemoradiation, that is radiation and chemotherapy, is finished, then we call the patient back after some time, maybe about 8 to 12 weeks later, for reassessment of the response. Once the response is assessed, then we keep the patient under follow-up. So follow-up is for next 5 years. So initially, once in about 3 months, we keep them. We call them to do examination and also some investigations, and subsequently after 2 years it's once in 6 months. This is about cervical esophageal cancer treatment. Thank you.